Hello, my name is Anaya Webb, and this is my final return demonstration over the head to toe assessment. For this video, I do not have a patient, so I just will be explaining the steps of what is done during this assessment. So first, I will start off with AIDED by introducing myself to the patient and letting the patient know that I will be their student nurse for the day and that I will be completing a head to toe assessment, and it should take no more than 10 to 15 minutes. I would thank the patient ahead of time for being a participant and cooperating as I am completing the assessment, and I would of course do hand hygiene and provide privacy by shutting the door or pulling the curtain. I would also identify my patient with 2 patient identifiers by using their name and their birthday, and I would match that up with the information that is on their wristband to the information that is in the computer to make sure that I have the correct patient. After that, I would assess my patient's allergies and their pain level. I would have them rate their pain level on a scale to 0 to 10, 0 being no pain and 10 being the worst pain. After I've done that, I will move on to assess my patient's general appearance. So first, I will start off with assessing their level of consciousness. I will ask my patient person, place, time, and situation to assess that my patient is A&O times 4, which means that they're alert and oriented times 4 if they're able to state their name, the place, the time, and the situation, which will be their name. I would say Mark Brown. Time, it is 7:35. Place, they're at a doctor's office. Situation, they're here for a head to toe assessment. After that, I would assess my patient's behavior by assessing for their mood. I would assess to make sure that that the patient is calm, they look pretty much happy, or they're sad, or they're depressed. I would check for their speech and note that they have clear speech, and also that their facial expression is appropriate for the situation. After that, I will move on to skin and nails. So first, I will start off with inspecting my patient's skin. I will look at my patient's skin and make sure that my patient's skin, their skin tone is even toned throughout and it's appropriate to their race. I will also inspect their skin and make sure that there are no signs of lesions or wounds that are present. After that, I would inspect my patient's nails. I would take a look at their nails and I would note the color of their nails, that their nail bed is clear and there are no signs of clubbing. Next, I will check for a capillary refill by just pressing down on my patient's nails, and their capillary refill should return with less than 3 seconds. And that's how I check for capillary refill, just pressing down on their nail bed. After that, I will palpate my patient's skin. I'm palpating for temperature, so I will use the dorsal sides of my hand, and I would basically just run my hands down their skin. And if everything is normal with that finding, I would note that my patient's skin is warm and dry. After that, I will move on to head, face, and neck. So first, I'm going to inspect and palpate my patient's head. So I'm looking at my patient's head and I'm noting that their head is normocephalic. There are no signs of deformities. I'm palpating on my patient's head and noting that there are no signs of tenderness and pain. After that, I would assess cranial nerve number 5, and that is assessing my patient's motor and sensory with cranial nerve number 5. I am checking to make sure that I'm checking their motor and sensory. I can have to do like a chewing sensation. A chewing movement. I can also check for their sensation by using like a cotton ball or like a tip of a piece of paper, and I can run it across their skin and show that they're able to differentiate if it's a soft or sharp object that is hitting their skin. After that, I would assess cranial nerve number 7, and I'm testing for my patient's sensory of taste. So I can have them eat like a piece of candy, like something that's like sweet and sour, and have them determine and tell me if the piece of candy is sweet, if it's sour. After that, I would assess cranial nerve 11, and I'm checking for my patients if they're able to rotate their head either like side to side, up and down, if they're able to shrug their shoulders in that motion. Next, I would move on to my patient's eyes, and I'm going to assess my patient's eyes. First, I will start off with inspecting the external part of the eyes. I'm just looking at their eyes and making sure that they have no signs of discharge or redness. I can also, I'll have my pen light to also assess with my patient's eyes, because I'm going to check for their pupils with the pen light. But before I do that, I would inspect my patient's conjunctiva and sclera. I would note that they're both the sclera is moist and white, and their conjunctiva is moist, and everything looks clear within those two aspects. Those would be normal findings. Next, I would use my pen light, and I would use this to assess Perla. So as I'm doing this, I'm assessing my patient's pupils. I'm noting if their pupils are reactive round. They're round and equal and reactive to light and accommodation. So what I would do for that, I would just shine this just into their eyes, and it would note that their pupils constrict or dilate with light as I'm shining the light into their eyes and moving it away. I'm also assessing for accommodation with this. I would have them read a sign or read a clock that's far back. I'm also assessing cranial nerve 3, 4, and 6, and I can do that by assessing the 6 cardinal field gauge. I can have them follow this pen light just with their eyes, only the movement of their eyes. I can have them look up and down, side to side, and just kind of have them look in different directions, and just note that they also have accommodation with that, and that they have good movement within their eyes. After that, I would inspect my patient's ears. So I'm looking on the external side of their ears, and I'm just looking and noting that there are no signs of discharge or redness or anything. After that, I would assess cranial nerve number 8, and I would assess that by performing a whisper test. So I'll stand like a couple feet behind my patient, and I'll whisper a phrase in their ear, and if they're able to repeat that phrase back, for instance, I can whisper red bird, bluebell, and if they say those 2 phrases back to me correctly, that will note that they have cranial nerve 8 intact, and they're able to hear low pitched sound. Next, I would assess my patient's nose, and with that, I'm going to inspect the external side and the internal side. I would just look at my patient's nose and make sure that there are no signs of inflammation on the inside, no signs of discharge. I can look and note that my patient's nose is symmetric to their face. I can also check for bilateral patency within the nares by shining a light in their nose, and that it can show me that their nares are normal in that state with bilateral patency with transillumination with the pen light. Next, I would assess my patient's mouth and throat. So I'm going to inspect my patient's lips and their tongue and their gums, and I'm going to note that their lips, tongues, and gums, they are, the color of it, that it's pink, it's moist, it doesn't look dry, there's no signs of lesions or anything within their gums or their, their lips or their tongue. I will also assess, by doing that, I can assess cranial nerve 9 and 10, and I can assess that by checking my patient's gag reflex. I can take a tongue depressor and have them say ah, and I can push kind of stick the tongue depressor in the back of their throat to check their gag reflex. I can also check their speech with cranial nerve 9 and 10 by having them say a phrase, say COVID-19 or 2020, and that will let me assess and make sure that they have clear speech. After that, I can assess cranial nerve 11, And with cranial nerve 11, I'm checking for movement of my patient's tongue, so I can have them kind of like stick their tongue out and have them move their tongue side to side, up and down, just to show that they have good muscle movement within their tongue, and to show that cranial nerve, not cranial nerve 11, I'm sorry, cranial nerve 12. That's cranial nerve 12 with having the patient move their tongue side to side, up and down. That's cranial nerve 12. So I would note that cranial nerve 12 is intact with that movement, that they have good muscle movement with that. After that, I wouldn't check my patient's respiratory. I would inspect my patient's respiratory and auscultate. So with that, I will have my stethoscope. So before I start off, I will start off by in respiratory system. Yeah, I will inspect my patient's respiratory system, sorry. So with that, I have my stethoscope. So before I start using my stethoscope to auscultate, I would inspect my patient's anterior chest and make sure that there are no signs of use of accessory muscles, and you know, they don't have any signs of lesions or edema or anything on their anterior chest. After that, I will auscultate for the anterior and the posterior lungs. So first, I would start off with the auscultate the anterior and posterior lungs. So I'll use the diaphragm part of my stethoscope to listen for those parts, and I'm going to try to do my best to show on myself how I would listen to the lungs. So I will listen to the right upper lobe, right middle lobe, kind of in this part, right middle lobe and right lower lobe, and then we have our left upper lobe and our left lower lobe, kind of sort of down here in this spot. And then that's on the anterior side. And on the posterior side, I would do the same. I don't know how I can really show it. I guess I'll kind of use the book. So when I did the anterior side, I did 4 spaces. So I have the right upper lobe, right middle lobe, right lower lobe, left upper lobe, and left lower lobe. So I did 4 to 6 spaces on the anterior side. I did 5. On the posterior side, I would listen for 6 to 8 spaces. So I'm just gonna say this is my person's posterior side, and we're gonna say this is the left. This is the left side. I'm sorry, this is the right side, and this is the left side. So we're going to say this is my patient's posterior side. So we're listening again still with the diaphragm. So with the posterior side, I'm listening to 6 to 8 spaces. So I have the right upper lobe. Then we have the right lower lobe. Then we have the left upper lobe. And then we have left lower lobe, and left lower lobe. So on the posterior side, you have 2 spaces in each. So you have right upper lobe, and then you have the right lower lobe, left upper lobe, left lower lobe. I kind of hope that this is making sense. I don't really have a patient, so